Hi everyone, my name is Joanna Gretel Abinido, and I'm about to discuss one of the psychobiological disorders in mental health nursing, which is bipolar 1 disorder. But prior to that, let me tackle first what is bipolar disorder. Bipolar disorder is a chronic recurrent illness that must be carefully managed throughout a person's life. It was formerly known as manic depressive illness or manic depression. Bipolar disorder is a mental illness that causes unusual shifts in a person's mood, energy, activity levels, and concentrations. It has 3 types, and all types involve clear changes in mood, energy, and activity levels. What are the types of bipolar disorder? First is bipolar 1 disorder. This is diagnosed when a person experiences a manic episode. During a manic episode, the person with this type of bipolar disorder experiences an extreme increase in energy and may feel on top of the world or uncomfortably irritable in mood. Next is bipolar 2 disorder. It has at least one major depressive episode and at least one hypomanic episode, and people return to their usual functioning between episodes. Another type of bipolar disorder is a cyclothymic disorder. It is the milder form of bipolar disorder involving many mood swings, with hypomania and depressive symptoms that occur frequently. Individuals with cyclothymia experience emotional ups and downs but with less severe symptoms than bipolar 1 or 2 disorder. Bipolar 1 disorder. In this disorder, the person has at least one manic episode in their life. A manic episode is a period of abnormally irritable or elevated mood or high energy accompanied by abnormal behavior that disrupts life. In bipolar disorder, most people suffers from episodes of depression, and often there is a pattern of cycling between mania and depression. What causes bipolar 1 disorder? First is genetic factor. Bipolar disorder is more common in those who have a family member with a disorder. Next is biological traits. Imbalances in neurotransmitters that affect the brain may also play the role in having bipolar 1 disorder. Next is environmental factors. Life events such as abuse, mental stress, significant loss, or a traumatic event may trigger an initial episode of bipolar 1 disorder. Anatomy and physiology of the brain. MRI scans of people with bipolar disorder show changes in the following areas of the brain. First, in the prefrontal cortex. It shows a decreased gray matter volume, specifically in the subgenual prefrontal cortex, which appears to regulate the mood. Next is in the medial temporal structure, which shows an increased amygdala size, which can have an impact on emotional regulation. Another area is the subcortical structure, which shows enlarged areas in the center of the brain that control emotional, cognitive, and social behavior. The neurotransmitters that are involved in having bipolar 1 disorder includes noradrenaline, serotonin, and dopamine. Noradrenaline is responsible for alertness, memory, attention, and anxiety. If level is too high, it causes manic episodes, and when noradrenaline is too low, it causes depression. For serotonin, it is the one responsible for mood stabilization. Low levels are strongly correlated to major depressive episodes. Dopamine, direct role in serotonin and noradrenaline regulations, and this regulation may play an independent role in manic and depressive episodes in those with bipolar disorder. Now let's talk about this patient named Alfred G., a 25-year-old male, Asian Filipino in culture, living in Regina, Saskatchewan with his parents. Alfred G. was diagnosed with bipolar 1 disorder with no comorbidities identified. His existing social support includes his parents and siblings. Alfred G. was diagnosed with bipolar 1 disorder 2 years ago and has history of psychiatric admission due to suicide attempts. Therapeutic communication skills. For patients that states he's have been tossing and turning all night, the direct quote that I'll be using is, "You're having difficulty sleeping," which is paraphrasing. Next direct quote that I would be using is, "You seem upset. What happened?" This is a therapeutic communication called making observation. For the nursing process, priority nursing diagnosis that I will use for this patient is sleep pattern disturbance related to hyperactivity as evidenced by fatigued appearance. Treatment goal. The patient will achieve optimal amount of sleep. Nursing intervention. Ensure that the environment has minimal stimuli and encourage the patient to do calming routine like taking warm baths before bedtime. Evaluation. Patient was able to perform calming routines prior to bedtime. Outcome. Patient verbalized having optimal amount of sleep as evidenced by well-rested appearance. Another nursing diagnosis for Alfred G. is risk for other directed violence related to the patient's manic state as evidenced by aggressive speech and threats of hurting others. Treatment goal. The patient will be able to demonstrate techniques to control emotions and impulses by discharge. Nursing intervention. Provide patient with a calm environment with less stimuli and encourage mild physical activities to relieve tension constructively, like walking. Evaluation. Patient was able to recognize effective activities that helped him cool down. Outcome. Patient was able to demonstrate ways to relieve his tension. The pharmacological intervention that is used for Alfred G. is lithium carbonate. Lithium carbonate is used to treat manic depressive disorder or the bipolar disorder. It works to stabilize the mood and reduce extremes in behavior by restoring the balance of certain natural substances or neurotransmitters in the brain. For this patient, the health teaching that I would provide for Alfred G. and for his family includes continue taking the medication even after the current episode is over, monitor lithium blood levels very closely to prevent lithium toxicity, eat normal diet with normal salt and fluid intake, to stop taking the medication if he's having excessive diarrhea, vomiting, or sweating, not take diuretics when taking lithium, take lithium with meals, have your kidneys and thyroids checked as well periodically if taking lithium for long period. Don't take over-the-counter medication without checking first with your physician. Keep a list of adverse effects and toxic effects and the person to be contacted if these effects occur. And lastly, if this medication is to be continued, the dosage should be tapered gradually. The community support resources that I would provide for Alfred G. are mental health, mood disorder support group provided by Saskatchewan Health Authority, the Caring Place Regina Incorporated, and Turning Leaf Support Services. In case of an emergency or crisis, these are the following numbers that the patient may use. The province-wide professional health advice and mental health support, 24/7 Regina Mobile Crisis Services for Suicide Line, and Mobile Crisis Helpline. These are the references that I used in this report. That would be all. Thank you everyone for listening. and enjoy your day.